Hi guys, welcome back. In this video we shall be talking about shock. Now what is the definition of shock? The definition of shock is it is a clinical syndrome. Syndrome means there will be a lot of features, not just one features, which is going to be caused due to inadequate tissue perfusion. Just remember it is a clinical syndrome means there are multiple symptoms, signs that is going to occur due to inadequate tissue perfusion. That is the definition, right? So what are the classifications? That means what are the types of shock, right? So we have hypovolemic, we have traumatic, we have cardiogenic, right? We have septic, we have neuro, and we have, okay, we'll just talk about the basics one, right? So whenever we're talking about hypovolemic shock means there is reduced amount of volume. Now what volume you're talking about? It's the blood and the fluid, right? And remember, hypovolemic shock is the most common type of shock. Most common type of shock is hypovolemic shock, right? So we're gonna talk about hypovolemic shock now. As I told you, it's the most common type of shock, right? Now what are the cause of hypovolemic shock? Again, what I told you, there will be reduced amount of volume. That is the reason it is known as hypo means less, volemic means volume, reduced amount of volume, that is going to cause you shock. Now before we start off any topic about shock, we have to understand there are two formulas that we have to remember. Blood pressure is the product of cardiac output times total peripheral resistance, and cardiac output is stroke volume times heart rate. That now the blood pressure is cardiac output, how much the heart is able to output. If you multiply with the total peripheral resistance, that is mostly you get this total peripheral resistance means the blood vessels that are present in the periphery, in the limbs, right, in the away from this systemic area, that is known as total peripheral area. And cardiac output means stroke volume multiplied by the heart rate. Now remember, this stroke volume can't be changed, right? It can't be changed, but this heart rate can be changed. Why I mean by this, if you see some very trained athletes, very trained athletes who have been doing a lot of aerobic exercises, or like highly trained military personnel, a lot of athlete, physically active person, their stroke volume is a bit more as compared to the normal individual. So in order to maintain the normal cardiac output, the heart rate is a bit less in those kind of individuals. Normal heart rate is around 60 to 100, average is around 72, but in this personals you can find the heart rate will be in low 60s, 65, like that. It will be less, right? That is what you have to understand. Now once we know this the formulas, now let us talk about the causes of hypovolemic shock. Now why will the volume reduce? The volume will be reduced due to blood loss. Why will you have blood loss? It can be due to trauma, surgery, right? It can be due to trauma or surgery. Now, and again you can say bleeding, any kind of bleeding, there will be blood loss. Now this bleeding can divide into two types: hidden, exposed. What I mean by exposed, it means exposed means external bleeding and hidden means internal bleeding. Now if I'm bleeding inside my chest, or if I'm bleeding inside my abdomen, you can't see it, right? If I have a fracture of my femur bone, or if I have a fracture of my pelvis, I'll be bleeding huge amount of blood, right? So those that will be inside my body, you can't see it, but still I'm bleeding. That times you'll be able to see the features of shock, and you might be having a history of injury to my pelvis or the femur bone. And exposed is something if I have a penetrating trauma or if I have a laceration, incised wound, I have an amputation, that times you'll be able to see the exposed type of bleeding, right? Along with this, another cause is loss of plasma. Now, loss of plasma. This you generally see in burn patient. Why do you see this in burn patient? This is actually known as the third space loss. Right, there is third space loss. So you have edema here. Edema will be positive here, right? Again, along with this, if you are vomiting huge amount of blood, you're vomiting massive vomiting or excessive diarrhea, what is happening? You are losing fluid here, decreased fluid, diarrhea, reduced fluid, right? So along with this, whenever you are vomiting and in diarrhea you're losing salt. Remember, salt attracts water. What does salt do? Salt attracts water. So if this is the blood vessel, you have high amount of salt, this will attract the water. So your blood pressure goes up if you're having high amount of salt, right? That is the reason, try to reduce the amount of salt in your diet, right? So this is the cause of your this thing, hypovolemic shock. Now what is happening in the how do I say, the pathophysiology, that is what is actually happening, what is actually happening in hypovolemic shock, right? So whenever we are saying about pathophysiology of the hypovolemic shocks, we are going to say there is loss volume, whatever you say, volume. Now what is this volume? Again, fluid and blood, right? So what will happen if there's loss of this thing? There will be reduced amount going to heart. There is less amount of blood going to heart because there is no blood in the body only, right? So there will be less amount of ventricular filling, right? Now what will this cause? This will reduce stroke. This will reduce your stroke volume. Now what will this do? It will reduce your cardiac output. So there will be decreased blood pressure. Decreased blood pressure will cause you what? Will cause you reduced tissue perfusion. So you will be having shock. Again, I'll write the formula here. Blood pressure is cardiac output times total peripheral resistance, and cardiac output is stroke volume times heart rate, right? Why the stroke volume is reducing? Because there is no filling. If there is no filling, what it will throw out of the heart, right? You have the heart like this, right? Top part you are having the atrium, ventricle. This is your left ventricle, this is your right ventricle. Blood will come here, then it will get to go to your right ventricle. From right ventricle it will go to your lungs. Again from lungs it will come to left atrium. From left atrium it will go to left ventricle. From left ventricle it will pump out to your body, right? That is what is going to happen. So if there is no blood coming here, what it will throw out? So that's the reason the stroke volume is reduced. That means the cardiac output is reduced. Cardiac output is reduced. This means what? The blood pressure is reduced, right? So you have to remember this this thing. So now what will happen if the blood pressure is reduced? Again, what is going to happen actually if the blood pressure is reduced? Now whenever there is less amount of blood pressure, as I told you, there will be reduced tissue perfusion. What will happen? There will be reduced tissue perfusion. In order to compensate this, our body will go in anaerobic, not aerobic, anaerobic. Okay, it will go in anaerobic respiration, metabolism it will go. So what will happen, you know, there is always a production of lactic acid, right? So if there's lot amount of lactic acid, what will happen, it will cause metabolic acidosis, right? Along with this, our body is very smart, it will try to adjust somehow, anyhow it will try to adjust the situation. So it is going to activate the compensatory mechanism, right? I'm writing it CMA, that means compensatory mechanism activation, right? There is activation of compensatory mechanism. What is this? It will cause the body to release noradrenaline and adrenaline. What it will cause? These are sympathetic. Okay, sympathetic means what? You're in a state of stress, fight or flight motion. If you're just relaxing, sitting in bed, watching movies, that is your parasympathetic. Sympathetic means you are in scared motion, right? You're releasing these two hormones. What it will cause? It will cause two things. It will increase the pulse rate, right? And it will increase the total peripheral resistance, right? So for some time, as a compensation, your body BP will be normal. Then after some time, your BP will drop. So what you see here, BP will be normal for some time, and then in later cases it will be reduced. Along with this, you see the pulse rate is increased. The pulse rate is increased. Why? Because of these two hormones, adrenaline and noradrenaline. These are sympathetic stimulation, right? So let us try to talk about the clinical features. Now, what are the symptoms, like clinical features of hypovolemic shock, right? So as I told you, there will be reduced blood. So reduced blood means what will happen? If there is reduced blood, so reduced blood is going to your kidney, right? So there will be reduced GFR. So what it will cause? It will reduce your urine output, right? It will reduce your urine output. Along with this, there's reduced amount of blood. So your skin and your legs and your distal parts will be cold periphery. Because there's reduced amount of tissue perfusion. Along with this, there will be less amount of blood going to your brain. So what will cause? You will be drowsy and you will be confused, right? You will be confused. Along with this, there is, as I told you, there is metabolic acidosis, right? In order to compensate this metabolic acidosis, your body will increase respiration rate. What it will do, if it is increasing the respiration rate, you will be throwing out CO2. So if you are throwing out CO2, your body will come towards the alkaline. It is doing CO2 washout, right? Along with this, if you are having sympathetic stimulation, you will be sweating. Your pulse will be increased. Your BP for some time will be normal and then will be reduced, right? So these are the things that you will be seeing in a patient who is having hypovolemic shock, right? So we will make some couple of more videos about this shock, which is very, very important. And that's all for now. I'll see you in the next video. Thank you.